People who perceive themselves as active cannot identify the intensity recommended by the physical activity guidelines. Several health organizations, such as the World Health Organization, Center for Disease Control and Prevention, and CSEP, Canadian Society of Exercise Physiology, use heart rate zones to recommend physical activity intensity to the general population. To optimize health benefits associated with aerobic physical activity, guidelines often recommend at least 150 minutes of weekly physical activity at a minimum moderate intensity. They also include 2 days of resistance training. We ask the question, are physical activity recommendations too vague? What is moderate intensity? And more importantly, can people recognize their own aerobic moderate intensity heart rate zone? Moderate intensity is typically 40 to 59% of the individual's heart rate reserve, and heart rate reserve is calculated by subtracting their resting heart rate from their maximal heart rate. Accurate perceptions of exercise intensity are important. Physiologists will often prescribe physical activity at a specific intensity. However, without heart rate monitoring tools, it may be difficult to adhere to the specific heart rate zone and the exercise prescription. Accurate perceptions of exercise intensity are also important because if individuals underestimate exercise intensity, it may decrease the odds of meeting their goals and expectations and therefore negatively impact their exercise adherence and physical activity levels. If individuals overestimate exercise intensity, they may discontinue their current training when they become injured, sick, or older because they do not believe they are reaching moderate intensity and therefore accumulating no additional health benefits through aerobic exercise. So our question asks, can active individuals identify their exercise intensity based on common physical activity recommendations? Our study had 3 main objectives. 1. Could individuals identify moderate intensity exercise correctly, which we would evaluate through a treadmill test? 2. Do active individuals know and reach the physical activity guidelines, which we evaluated through questionnaire and a 7-day evaluation where participants were given a heart rate monitor and physical activity log? And 3, what are some of the characteristics specific to those able to identify moderate intensity? Only 11.8% of our sample correctly identified moderate intensity. The majority of people overestimated moderate intensity, with 8% underestimating the intensity level. 83.3% of individuals with accurate perceptions of moderate intensity met the aerobic portion of the physical activity guidelines, compared to only 68.9% of individuals with inaccurate perceptions of moderate intensity. As a whole, when considering resistance training, under 35% of our entire sample met the physical activity guidelines. In conclusion, most individuals who self-identify themselves as active are not able to accurately identify moderate intensity exercise. Most individuals overestimate moderate intensity exercise, and simple and affordable strategies to identify physical intensity should be developed to help adults identify what is needed to reach these guidelines and derive health benefits. Such findings have a practical relevance for the prescription of physical activity among a population that is already active and potentially very receptive to interventions helping them meet the physical activity guidelines. For more details regarding the perceptions of physical activity and exercise intensity among active individuals, please refer to our article.